Nope, but just the arrow just shot over to the left now.
Okay. So Bill said he's on an Apple as well, and that, yeah, you should see that little button up there that it'll either say speaker view or gallery view.
Yeah, and I saw it, but the reason I never saw it before is because I've always seen these pictures across it.
Gotcha.
I think you have to put your mouse up there, Doris.
My mouse is
right hand corner, and it'll show. Like right now, I've got it on speaker view, but
no, I've got my mouse. I'm clicking it, and nothing's happening.
Okay. Are you seeing just one picture, like a big image of me, or are you seeing?
No, I see 6 people across the top.
Just only across the top.
Yeah, and that the last one, the furthest to that angle, is Steve.
Gotcha.
And he's covering up gallery view. It's okay. I don't need to get gallery view. It's
right. I don't know.
Gallery view is what you've got. You don't have the speaker one.
Well, I do. I don't have gallery view.
Well, you see the people, so you have to.
I only see 6 people.
Yeah, but if you had the speaker view, you'd only see one person. The guy that was speaking, the person that was speaking.
Oh, well, I see you real big.
That means you are on speaker view, right?
Good. Now I see you real big.
Right. So that button's up there somewhere. That's going to be a little challenge to try to see if you can find it.
Okay, don't worry about it.
Okay, so I have started recording. So if people want to go to the chat box and where it says type your message here, click your cursor there, type your name, and then hit enter or return on your keyboard and your name will go in. Ed Cranston's the winner, he's first. Hey, Dan. Okay. So Doris, it did show up. It's in there.
Yeah, it did. Thank you.
You bet. So can I ask who, I don't know everybody's faces, but who's on Jan's iPad?
I am. Jim Down.
Jim Down. Okay, great. It just says Jan's iPad.
That's my wife's.
Got it.
Hey, Chuck, who cut your hair?
Well, who do you think? Me.
Did you just shave your head? Is that what you did? That's what it looks like from here.
I cut it very carefully. Right now, the only picture I see is 2 friends, including my wife and myself, at a party, and I don't know how I got that.
Okay. What are you on, a computer, a Mac, an iPad?
Laptop.
Okay. So in the Zoom meeting, do you see anything near the top that says like speaker view or gallery view?
No.
Okay.
What I've got is my photo album, obviously.
Right. Can you, if you close that, that might.
There you are. There you are.
So just a reminder to everybody to go into the chat box where it says type message here, click there, type your name, and then press enter or return on your keyboard, and then your attendance will be noted.
I see it now. Okay.
You see the button, Doris?
Nope, it's not there.
Not there.
It's covered up.
Hi, Pete.
Who says that?
Barb, how are you doing? And am I coming through?
Yep, you are. You're doing good. You're wearing that nice Rotary blue shirt there, Jim.
Yeah, you bet.
Yeah.
I should have my button. That'd be kind of nice.
Yeah.
Here, Jim.
Oh, Gary's got one on for you.
All right. Good.
Okay. So can I ask, who is Jerry's iPhone? Jerry who? Jerry's iPhone, you want to give me your last name so that I have it handy?
I don't see it.
Barb, I wonder if it's Waterlow.
Got it.
Hold on.
So just,
I was connecting to audio. Jerry Waterlow.
perfect. Thank you, Jerry.
Yep.
So just a reminder to people that you should open up the chat box. And in the chat box, you should find the little area that says type message here.
Where does the sound thing come out of here?
If you click there, then you can type your name and then press enter on your keyboard or return, and that way I will have your attendance.
I'm on here. Okay, nice.
So just a reminder, again, I will say it probably many more times, more than you want to hear, but I'm going to say it again. So to all of you that have just joined in, please go to the bottom of your screen and find the chat button. Click on that, and in the chat button, there should be an area where it says type message here. You should click there, type your name, and
Hi, are
press
you on?
your keyboard.
Okay, good.
And then I will have your name for attendance. Thank you. So Linda Mustin is your better half there here today?
Not at this moment, but he's coming.
Coming? Okay. I'll sign him in.
Sign him in.
You got it. And I see at least one visiting Rotarian. Again, a reminder to everybody who is signing into the meeting, please make sure you open up the chat box and type your name in, hit enter afterwards, and that way your attendance will be recorded.
Welcome, everyone. Notice it's 12 o'clock. I think we've been starting about 12:03 the past couple weeks, which gives everybody just a little bit of time to get logged on here. So we'll do that again today. We're already past 60 participants and hopefully on our way to 80 or 90 again. So we'll begin the meeting shortly.
So just a reminder to everyone, as you log in, please open up the chat window and type your name in, hit enter on your keyboard, and that way your attendance will be recorded. And thank you to any of our guests who have kind of listed who is your guest today. I appreciate that. That'll kind of help us. So again, just a reminder, as you come into the meeting, please open up the chat window and type your name in and hit enter. And then we will have your attendance.
Great. We'll begin the meeting in about 1 minute. All right, we'll go ahead and begin. Welcome, everyone. We'll call the meeting to order today. It's about 12:03. Real excited, again, as I said each of the past couple weeks with the participation in these meetings. I think we're up over 75 already today, hopefully on our way to 85 or 90. We've just, as a board, been real pleasantly surprised with the participation and the fact that we can just get together in any method. Of course, there's never any substitute for the opportunity to meet in person and to share fellowship as Rotarians, but given these circumstances and the opportunity to meet virtually, We're just so pleased that so many of you are taking this opportunity. While it's the best we can do, and we're real pleased with the participation, we still aren't reaching everyone. And our ask this week is for you to think about somebody that possibly you've been seated by at a table the past few months, or somebody that you haven't seen online, or you haven't seen their name on the attendance list. If you think of it, reach out to that person and let them know that you've had a good experience participating on these Zoom meetings, and encourage them to join us, because while it's great that we've got 80, 90, and maybe the goal for today is even 100, we're still not reaching everybody. We'd like to do everything we can to reach out. So please help us out, and think of those that maybe we could have join us on next week's meeting. We always start the meetings with the Pledge of Allegiance. So please join me and stand, and we'll begin with our pledge. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Thank you. You may be seated. All right, wonderful. As we always do, we're going to begin with some tips about how to use Zoom from Barb. So Barb, we'll turn it over to you.
All right. Hello, everyone. So first off, we're going to talk about, I'm going to do things in a different order today. I'm going to keep it a little tricky for you. Okay, so the first thing that I want you to do is I want you to look at the bottom of your screen and find something that looks like a microphone. And I want you to mute that. So click on the microphone and that will mute your microphone. If you make an announcement, you will need to unmute that. Now, I might be able to help you, but it's always kind of better if you do it yourself. Beside that icon, you see what looks like a video or a little TV camera. So if you click on...
She's talking about doing something with a microphone. I'm lost in what she was saying.
If you click on the microphone, it will stop your video. And so instead of seeing yourself or all of these little pictures, instead you're going to see either people's names, or if people have put a photo into their profile, you might see that. So we're going to want to use that stop video screen when it comes to especially to the program, because what happens is that if everybody's using video, you're actually, it's creating a lot of noise for the bandwidth. And so your speaker might break up a lot. So especially if you hear that, I want you to go in and mute the video. Okay.
Well, if it breaks, if you have to go to the mute speaker.
All right. So in addition, I want to make sure that you know about the speaker view and the gallery view buttons at the top right of your screen. If you go to gallery view, you will see a whole bunch of different little boxes with all the pictures of people or their names, videos.
I'm lost.
Full screen.
And then in addition, if you click on speaker view, then you will see just a large image of the person who is speaking.
I don't see it.
I don't know.
Okay.
So, and I
would just leave it. I don't know what she's talking about.
Yes. All right. Well, let's continue. We'll next we'll introduce some guests. In the interest of time, since we can see that we do have quite a few guests with us, if you are a guest today, please click the raise hand icon at the bottom of your screen, and Barb will call on you. And when she does, just give us your name and who you are a guest of today. So let's begin with guests. Barb, I'll turn it over to you. Who has their hand raised and would like to be introduced today?
Sure. And for those who are looking for that button, you will find it if you click on the participant button at the bottom. Another little window will open up, and you will see at the bottom of that there's another button that says raise hand. So first we're going to call on Amy Nicholson, who has a guest, or is a visiting Rotarian as well.
Hi, Amy Nicholson. I'm from Iowa City AM. It's nice to be here.
Thanks, Amy. Welcome.
And next, Hazel Siba.
Good afternoon, everybody. My name is Hazel Seba. I'm a member of the Iowa City AM Club. Nice to see you all.
Hi, Hazel. Thanks for joining us.
And next we have Michelle Presley.
Can you guys see me? Hello? Perfect. Michelle Presley, guest of Ryan Bell today.
Great. Welcome, Michelle.
Thank you.
And next, Salome. Salome, if you could unmute your microphone.
Got it.
There you are.
Hi, my name is Salome Philman. I'm the Healthy Kids Clinic Coordinator, and Susie Fulton invited me to speak today.
Great. Welcome.
Thank you.
Next, Bill Easton.
Hi, everybody. Bill Easton, and I am a guest of Ryan Bell.
Excellent.
And next, John Colshaw.
Hi, everybody. This is John Colshaw. I wanted to introduce my guest, Russ Gannam, who is the Associate Provost and Dean of International Programs at the UI.
Wonderful.
Next, Liu Hong.
Hello.
Hello.
Hi, can you hear me? Hi, I'm Liu Hong. I'm the guest of the Dr. Edinger. I'm working in the College of Dentistry at University of Iowa.
Excellent. Welcome. Thanks for joining us.
Thank you.
Next, we have Jim Merchant. Jim, do you have a guest?
Jim, you're muted.
Okay. Next is Phil. I think it's Phil.
Hi, Phil Peterson from Iowa City AM.
Great. Hey, Phil.
Next, Gary Pasha.
My guest is my wife, Nancy Pasha from Iowa City AM.
Never heard of her. Just kidding. Welcome, Nancy. We're so glad to have you. Thanks for joining us.
Wonderful. Next is Brian Clemens.
Good morning. Brian Clemens, AM Rotary, guest of Peter Wallace.
Wonderful. Welcome. Next is Alyssa.
There we go. Hi, I'm Alyssa Brandt-Jarrett from Brandt Heating and Air Conditioning in Iowa City, and I am here as a guest with Mr. Ryan Bell.
Oh, that's great. And Bill Matthews.
Good afternoon. I'm with the Schaumburg, Illinois AM Morning Club, and my daughter was a 2010 graduate of the University of Iowa.
Oh, great. Well, thanks for joining us today. Welcome.
And Ron Ettinger.
We've got Sonia, my wife, here with me.
Wonderful. Thanks for joining us.
Wonderful, Jim. I think that is all of our guests and visiting
Great.
Rotarians.
Well, what a great group today. I see we're getting close to 90 participants. Wonderful. We've got a great program today, so we'll look forward to continuing. We've got a fun video to share today, just a neat message. And Barb, do you have that available off the top of the meeting here for us?
I do. So
Okay.
hold on just a minute. This is always a educational opportunity for me.
So far, so good.
My name is Chuck Swanson. I'm Executive Director of Hampshire Auditorium at the University of Iowa. And on behalf of the Hampshire staff and myself, we have a gift for you. It's a gift of music, but more importantly, a gift of friendship. As President Harold said, Hawkeyes care about each other, and we just want you all to know at this time what we're all going through. We do care. We miss the vibrancy on this campus. And we also want to give a very special thank you to all the healthcare providers at University of Iowa hospitals and clinics. So this is a song that we commissioned from Third Coast Percussion. They're a percussion ensemble, a quartet from Chicago, and and they're going to be part of Hampshire's season next year. So we hope you enjoy. We want to wish you all good health to both you and to your families. Go Hampshire, go Hawks.
Share.
What's going on there?
Go Hawks.
All right.
All right.
Very good. Well, Barb, am I back on?
Yes, I believe so.
All right. Well, very good. Well, if that video doesn't make you smile, I don't know what will. Certainly never heard the Iowa Fight song performed in that way, but a fun message. Nice to see Chuck there. I don't know if Chuck's on the meeting now, but Chuck, if you are, thanks for giving us that message. We are today, as we always do with these Zoom meetings, starting out with what we call Rotary moments of gratitude and positivity. We just feel they're nice ways to start our meeting. And again, there's no substitute for shaking hands and sitting next to each other at tables like we used to do, but we're going to do our best with some nice messages. And to continue that today, I've asked Mayor Bruce Teague to give us a few words with regard to positivity and gratitude. Mayor, I'll turn it over to you.
I am so excited to be here with all of you today. Can you hear me all right?
Yep.
Yes.
Yes. I am full of hope and gratitude. One, hope for our tomorrows in the midst of COVID-19. We're hearing that we could be here for a while, and that's the truth. And I think what we do with that information can be powerful as we prepare for what happens in the future. City Council will be discussing on Tuesday what it looks like for the city coming up. And we don't know what it'll all entail, and it'll continue to evolve. We're not sure what closures will remain and if it'll be fully lifted. But as we're navigating those things, I wanted to just say thanks to all of the heroes that are out there that are a part of Rotary. We are all doing some things within our community that is really showing what it really does mean to show service above self. And thanks to all of you. When I think about the heroes that are at the University of Iowa hospitals and clinics and the VA hospital and Mercy Hospital, but let's not forget some of the other people, the grocery store worker, and even those in home and community-based services, the people that drive the bus. Those are individuals that are frontline workers providing services in our community. As we know, COVID-19 is changing how we interact. We're meeting by Zoom, and I'm so grateful that I get to see you all this way. But when we think about the graduates of 2020 and how those are all changing for them, they're not going to have that traditional walk across the stage as many of you and as many of us have experienced. But there is some things that we're going to be adjusting to. But when I think about all that we're doing as a community, I can't help but to show gratitude for all of that. My wedding was scheduled for April 18th, and so it's postponed, and we're now trying to figure out what does it really mean to have a wedding in the future, because we could be here for a while. But even while we're making those plans and trying to adjust with what is our new way of living, I want to just impress upon people to continue to do the things that we should do for COVID-19. Wear your mask, wash your hands frequently, wear gloves when possible, and keep your distance. I think that message won't change. But one thing I want to do is just tell you what my hope is. My hope is for all of us to stay safe and healthy because we're in this together. And I'm going to leave you with this. I see trees of green, red roses too. I see them bloom for me and you. And I think to myself, what a wonderful world. We're in this together. Thank you.
Wonderful. Well, Mayor, outstanding. I don't know how to follow that, but thanks so much for your uplifting words and your voice, and even more so for your leadership and your positivity. We're lucky to have you, and we appreciate your time today. So thanks for your message, Mayor. We really appreciate it. I want to continue with some announcements. I think just to follow right along with what the Mayor has given for some updates, I'd like to hear from United Way. I don't know if we've got Trish with us or Katie, but Trish and Katie, can you tag on to what Mayor Teague has provided with any comments or updates that you have?
I'm not sure if Katie, have you opened your mic?
Yeah, I think Trish and Barb might want to talk about some gifts of food from us at Rotary to some very important people. Trish and Barb, you guys want to talk about that?
Barb, I'll go ahead and let you lead it off.
Barb?
Okay, I'll take that. So the board of our club wanted to do something for the 2 restaurant vendors who we have been using for our club meetings, who are actually having to deal with the fact that they're not getting the business they expected. And that's Big Grove and then Brown Deer, which is actually managed by the Marriott. And so working with our good friends at the United Way, we've been able to kind of work up a plan. It's a lot of logistics, but I think we're pretty much set that what we'll be able to do is to get approximately 300 meals from each of those vendors spread out over a number of weeks for a, hold on, spread out for a number of weeks and then delivered to some of the healthcare workers in our community, as well as also to some of the food insecure organizations within our community, like Shelter House, Table to Table. So we're still working through some of those final challenges, but our club is, our goal is to help our restaurants that we have worked with for a good long time, but then also help those in our community. And I couldn't be more grateful to the great support from the United Way, who is helping us make this happen.
Thank you, Barb. We're really excited to partner with Rotary as well. We've got a lot of great things happening with this. So many positives that are going to come out of it, not only for our restaurants and our vendors, but also for the recipients. Our vendors are graciously putting together individual boxed lunches for this event, which is a lift on their part, but they jumped right up and said they'd be happy to help out with that. So thank you to Rotary for supporting this effort. We're so pleased to partner with you, and we hopefully will have some pictures to share with you in the next couple of weeks of the process of the deliveries, and we'll go from there, but we'll keep you updated. I just wanted to share, in addition to that, right now with the community, as usual, we kind of give that little quick recap. United Way is also collecting masks for nonprofit organizations in our community. So if you're a sewer or if you've jumped on that adventure to learn to sew, we graciously will accept masks. We do have a receptacle outside of our office door so we can maintain social distance and social safe. So we encourage you, if that's something you'd like to do, to go ahead and drop those off, and we will forward those on to our local nonprofits. Besides that, we're just trying to keep up with the news with the weekday updates, and we'll just continue to be ready to pivot and move on to the future, no matter what that looks like.
Thanks so much, Trish. Go ahead, Katie.
I would just also share a quick update from Tuesday is what I have for our Community Disaster Relief Fund. We have provided help for rent assistance, medication, and household supplies to, at this point, 112 households that included 165 adults and 157 children. And we have released $84,820 to date. And so the need is there. Those folks that have been helped have to fill out an intake relief form. We don't get to see them face to face. Patty Fields takes all of that intake information. And then the actual funds go directly to, say, the landlord, or to get a gift card at Hy-Vee for household supplies, things like that. So we are proud to be a part of this incredible community and helping out people in need. And we would appreciate anything that you might be interested in supporting individually on this behalf, because there's no gift that's too small, and it's all going directly to assist people that are very vulnerable right now and in need. So thank you so much.
Thank you, Katie, and thank you, Trish, both for your updates here. They're just such an important part of our meetings, but obviously more importantly for all you're doing for our community. Couldn't do it without you, and you just seem to serve as a central command for all these vital roles that are being played. So again, thanks for all you're doing, and thanks for spending time to be with us each week. Really appreciate it. Additional announcements. I think Jim Merchant, do you have an announcement you'd like to share?
Yes, thank you, Jim. On behalf of our Heart Safe Community Committee, 3 items. One is we have our website is up. I invite everybody to take a look at it. You can find it at iowaheartsafe.org. And we have pretty well complete now. We now have an AED map on it, thanks to City of Coralville, City of Iowa City, and the University of Iowa. We have many more AEDs to put up, and there is an opportunity to list AEDs. We will be reaching out to the business community soon. Secondly, Diane Atkins will be making Zoom presentations on this program to 2 other Rotary clubs in the coming week. And then finally, thanks to Bill Bywater, who chairs our sponsor program, we will, in lieu of training, which had been really intended to drive our fundraising, and we've been, thanks to several of you and many others, we're about halfway to our $40,000 annual goal this year. But next week you will all be receiving a mailing from our committee with a bookmark ruler, Heart Safe Community bookmark ruler, and a donor card. And so we hope that the Rotary clubs will be able to step up so we can buy more AEDs and get them distributed around the community. So I think that's the announcement. Thanks.
Thank you, Jim.
Great.
Great
And,
work.
it looks like we don't have any other announcements, but before we move on, this is a good time to move to speaker view. That would again be in the top right-hand corner so that you can see a bigger picture of our presenters. In addition, make sure, I believe everybody's microphone is muted, but if you can, please, think about whether you want to mute your video just because it'll help lower bandwidth. That's it. Back to you, Jim.
Great. Thank you, Barb, for managing these meetings for us. Sure appreciate it. Next, to turn the meeting over to Dr. Pete Wallace to introduce our speaker. And for everyone that's participating, typically what we do is we go until about 10 to 1 with our program, then we open it up for questions and answers. So we'll do that again today. Dr. Wallace, I'll turn it over to you.
Pete, you might be muted, possibly. There you go.
Am I on?
You are on.
Yes,
okay,
you are.
thank you very much. I'm pleased to introduce Susie Fulton. Again, she's been here a few times, and welcome her to our virtual podium. She's a graduate of the University of Iowa College of Nursing, both bachelor's and master's in nursing, and is a certified pediatric nurse practitioner. Most of you know she served the school district as the health services director and coordinator from 2004 to 19. And as she has told us, she is a member of the AM Rotary Club and on the board of the Free Medical Clinic and the Big Brothers board. She is one of the initial founders of the Healthy Kids Clinics, and that's why she's here today. But more importantly, she's been the guiding light, the cheerleader, tireless advocate on behalf of these unserved and underserved kids for the 12-year duration of the clinic's existence. She retired from the district last year, and she and Jonathan are moving to Colorado, so this looked like a opportunity to hear one more time from her, and Devin and I have asked her to recap the history and success of the clinics. Susie?
Thank you, Pete. That was great. Thank you. I also want to introduce Salome Philman, who is with us, and she's going to help me with the presentation. Salome is our clinic coordinator, and she is just has so much experience. Salome has a master's degree in migration studies from the University of Kent, and she did her undergrad in Spanish and anthropology at UNI. She is fluent in several languages. She has been with the clinic for 3 years. She also works as an interpreter with the hospital, and she's done a lot of just work with immigrants and helping them access resources. So it's really great to be here. I hope I can make this work. I have to tell you, I put on makeup today because I was so excited to do this. It is a strange world that we live in right now, isn't it? I'm going to share my screen, I hope.
There it is.
Is that right?
Yep.
Okay, awesome. Thank you. So thank you. Yes, I have been to this group to present before. Some of this might be information that you already know, but I just wanted to give you a recap of what's been happening in the Healthy Kids school-based clinics for the last 12 years. You may recall the clinics were started in 2007. At that time, we were calling them Healthy Kids Community Care school-based clinics. We have kind of shortened that name. That seemed to be a lot. The goal of the clinics then and now is to improve access to healthcare. Lack of access was identified as a barrier to learning through the community needs assessment conducted by the Iowa City Community School District Board back in, I think, 2002, when they had a Barriers to Learning conference. The clinics were created after that with the help of community healthcare providers and stakeholders that came together and called ourselves the Unmet Needs Task Force. And Dr. Pete Wallace co-led this task force. So he has been very integral in the development and success of the clinics as well. The clinic started with some seed money from United Way, and they invited us to become a United Way partner agency, which has been awesome. Kudos out to them. Hi, Katie and Tricia. Then over the years, the clinics have been held in various places. It started out in the University of Iowa College of Medicine mobile clinics. We kind of went around just 4 schools once a week for a few months, decided that was just really crazy, very confusing. The schedule was confusing. It was a lot of work to load up supplies and then unload supplies. So we found some permanent space. And now we have 3 permanent clinic spaces in 3 buildings: Northwest Junior High, Southeast Junior High, and City High. We added a child psychiatry clinic 1 morning a week back in 2011. And then we added our own dental clinic, which is housed at the Iowa City Free Medical and Dental Clinic. And it is staffed by a volunteer dentist and Rotarian, Dr. Art Nowak. You may wonder what could prevent children from receiving healthcare in a community like ours that is so rich with healthcare resources. Barriers to accessing healthcare are varied and include not having any type of health insurance, or having insurance that has very high deductible, or it's just for catastrophic things. Not understanding the healthcare system, not having transportation to appointments, not understanding enough English or able to speak enough English to make appointments and go to appointments. And then there's also a limited number of mental health care providers in our community. As Rotarians, you are very familiar with the changes in our community over the past 12 years. You can see the numbers there. The needs of our families continue to change. So this clinic serves children in the Iowa City School District as well as all of Johnson County. So we get referrals from other school districts as well: Lone Tree, Solon, Clear Creek, Amana, West Branch. We also serve the preschool age, the 0 to 5-year-olds, and residing in Johnson County. Approximately 80% of the patients, the children seen in the clinic, do not have any type of health insurance at the time of their visit. The other 20% are insured by Medicaid, or have private insurance. School health has been evolving since the late 1800s. Originally, it was limited to public health nursing, but back in the 60s, access to care became a very prominent issue and continues. There are many different models for school-based health clinics across the country. Most often, school-based clinics are operated by a local hospital or a Department of Public Health or a federally qualified healthcare center. The Healthy Kids Clinic here is very unique in that it is a true community collaboration that involves many community partners. Schools are an ideal place to offer care because children spend 40 hours a week or more in schools, except during this pandemic, of course. Schools are accessible and convenient. By seeing kids during the school day, it minimizes their time out of class. It keeps parents from missing a lot of work. And also, schools are familiar and trusted places for most families. These are the services that are provided in the Healthy Kids Clinic. Very comprehensive services. It's well child, it's immunizations, it's sick care, it's managing chronic conditions. We have the dental care through our volunteer dentist, Dr. Nowak, and the University of Iowa Dental College, and also Johnson County Public Health. We have the mental health care with the Child Psych Clinic, and then we work with some therapists in town. Vision care, I'll talk to you a little bit more about that. Referrals for specialty care, and care coordination and access to health insurance and medical homes are 2 big things that the clinic coordinators do. The coordinators work with the families to help them access insurance, first of all, whenever possible. Our goal as a clinic is to fill a gap. It's not to become primary care provider for children. We know that we have many excellent physicians in our town and excellent clinics, so we don't want to do that if at all possible. But because of access, because of lack of health insurance, because of poverty, we actually serve as a medical home for approximately 240 children. And this number continues to increase each year. So these children cannot afford any other type of health care. They do not qualify for any kind of insurance, like through Medicaid or through the CHIP, the State Children's Health Insurance Plan. They cannot afford to pay out of pocket, and the parents' employers may offer a health insurance, but it's very expensive. We also try to be culturally competent. So all of our coordinators are fluent in Spanish. And as I said, Salome is multilingual, so she speaks French and in addition. And then we have a family practice physician who is fluent in Arabic, which is very helpful. And we're working on getting all the materials translated to Spanish and French. So as I said, it's a true community collaboration. The clinics are able to provide so many services because of this collaboration between the school district, United Way, the University of Iowa, and community healthcare providers and agencies. Mercy, Iowa City was a key partner in the first years of the clinic's operation. Johnson County Public Health and Iowa City Free Medical Clinic continue to be integral partners with us. And the clinic's financial sustainability depends on the Community Foundation of Johnson County, where we have an endowment fund. And then of course, United Way it supports us financially, and also we are a partner agency with them. This is just an overview of the current workforce and who pays for what. So as you can see, there are many in-kind providers from the University of Iowa. Our clinics are open on Tuesdays at Northwest, Wednesdays at City High School, and Thursdays at Southeast Junior High. But they're open, like I said, to all children in Johnson County. Appointments can also be made on Fridays if needed. And then our dental clinic at this time is being held on Wednesday afternoons. So you can see we have volunteers, we have University of Iowa staff, and then we have our own clinic staff. The other part is that we are able to provide some specialty services, and these are through our partners and our collaborators. So in addition to providing the pediatrician and the family practice physician, the University of Iowa also provides free outpatient specialty care. So this is called Healthy Kids Charities Program, and this was started back in 2014, I believe. Dr. Marguerite Oding, who is our pediatrician and medical director of the clinic, worked with the University of Iowa to develop this program. And what it is that the clinic providers can refer children to specialty care outpatient clinics like ENT or neurology or orthopedics at no cost to the family. Like I said, most of our children are uninsured. And then if they do have insurance, of course, the university will bill that insurance. So in 2018-19, last school year, there were 14 referrals. And then we have the mental health services with the child psychiatrist, 1 morning a week. And then we have partners through the community of different agencies that provide mental health counseling at school. Alberhaski Eye Clinic, McDonald Optical, and Eye Associates are all great partners. They offer no-cost exams to children referred from the clinic. And then Alberhaski provides glasses at no cost. McDonald Optical provides glasses at no cost. And then Alberhaski and Eye Associates provide reduced rate on glasses, like $50. Very inexpensive. And then we have our dental program that we call Bright Smiles. That's with Dr. Nowak at the Free Medical Clinic. We use the hygienists through the Johnson County Public Health, and then the College of Dentistry charges us student rates. Corridor Radiology provides up to $2,000 of x-rays and interpretation each year, and then once we meet that $2,000, they will do it like half price. We have all of our blood work lab work done through this free medical clinic at no cost. And then ChildServe provides scholarships for therapy services like OT and PT. So here are the numbers. You can see how we're growing. When we started in 07-08, we had 209 patients with 312 clinic visits. And this past school year, 430 patients with 693 visits. And there's the dental referrals and the child psychiatry patients, the vision referrals, and then the specialty care. When looking at these numbers, I just want to talk about there's still need. There's still some things some kids that we're not reaching. So Iowa City School District enrolled 14,285 children last school year, 18-19. We know that 5% were uninsured, and that was based on the registration information that parents complete, plus the Department of Public Health does some estimates. And then based on past experience, we know there's another 1% that have health insurance, but they need our services. They're not able to access it because of like the things I talked about before. They don't understand the healthcare system. They have transportation issues. They have language issues. Perhaps it's a family that just can't quite get it together to have the children receive routine or even acute care. And so and patients average about 2.2 appointments, which is consistent with the other outpatient clinics, like other outpatient pediatric clinics. So that means there's 860 uninsured kids in the district. We are serving about 400 of those. But in order to see all 860 2 times a year, we would need 1,900 appointments. And currently we're only offering around 700 appointments. So there's definitely a gap that we still could fill if we had the resources to do that. Let me go back to that. So this year, however, up to March 26th, and that's when COVID hit, and we've had to decrease the amount of clinic services, just like all other clinics. So, but up to that point, the clinic had 611 medical visits so far this year. So we were on track to do again around that 700, 800 or 800, possibly up to 800 medical visits. So with coronavirus, we're only doing 2 afternoon clinics a week right now, and it's very strict on who we're seeing. We've stopped the well child at this point unless there's a real need. We are continuing to immunize children so they can keep it on track for that. And then if kids have any kind of respiratory symptoms, we refer them to the University of Iowa. And the university is seeing uninsured through this to be evaluated for the COVID-19. Okay, so funding. This is where many of you have come in and been very generous in donating to our different funding sources, and we thank you for that. So the operational budget is about $180,000 a year. The United Way campaign brings in $60,000 plus each year. Plus there's always some designated donations, so $60,000 to $70,000 each year. We have had various grants over the years. We have people who donate directly to the clinic operating fund, which is the school district serves as a fiscal agent for that. So it's directly donating to the district to go to the clinic. We have an endowment fund at the Community Foundation of Johnson County that Mercy started as a matching fund back in 2008. So over 5 years, they matched $100,000 per year, and ACT also matched $125,000 over 5 years at that time. So our fund was at close to 1.9 million at the end of fiscal year 19. I'm afraid to look to see what it is right now, but I think it's my understanding things are looking better. So hopefully it will improve. And we draw down anywhere from 4 to 5% each year to have more money for our operating expenses. All right, then this other thing that we've been doing, but are taking a hiatus this year, is the Get Moving for Healthy Kids 5K and youth events. This was an annual fundraiser for 10 years. And this is where Dr. Pete Wallace comes in. He has been an amazing champion in raising money for this event. So it has raised $670,000 that has gone to the endowment fund over the 10 years. I know there are at least 27 new Rotarians have contributed to this fundraiser. The event is put together by community volunteers. Another Rotarian, Ann Parker, has been very, very integral to this event. And like I said, we had it for 10 years. We're not doing it this year just because of my leaving the district and kind of all the transitions. And we may look at a new event in the future. So that's where I end my presentation, but I want to hand it over to Salome. So I'm going to get out of here because Salome has things to talk about. She has some great stories to tell, and she is in the thick of it. So Salome, I'm going to hand it over to you.
Okay, thank you, Susie. I am just going to tell you, I won't take up too much of your time, but I wanted to talk to you about two case examples because some of you may be wanting to sort of imagine what kind of kids, healthy kids in this community is helping. I want to give you two examples of uninsured children. So as Susie said, about 80% of our patients are uninsured. Now we have uninsured children who are eligible for insurance and who we serve just for a short time until they can become insured again. Or we have uninsured who are ineligible for insurance. Many of these children will be our patients for the long run, probably. It could be a couple years, it could be until they graduate high school. So again, we serve children from 0 to their high school graduation. And so that can be up to 21 years. So I'll use obviously fictitious names, but one patient, I'm going to call him Junior. He actually came to this area because he traveled here as an unaccompanied minor from Central America, came from a very impoverished area and was fleeing violence and poverty. He was able to tag along with some other adults that were coming at that time, but he had no family members with him when he arrived and in the US. And he was put into one of the immigration processing centers, and he found a family to sponsor him here in Iowa City, distant relatives. So first of all, I'd like to commend their generosity. And there are so many families out there helping children. And so that's a really touching and special thing that we get to see at Healthy Kids. And actually both of my stories here will be exemplary of that. Anyway, so he came and we don't know obviously when people enroll in the school. However, somehow they get referred to us. And so this time it was through a teacher who was trying to work with him, teaching English. And this teacher came to us and said, listen, I don't know what's going on with one of my students, but I'm not able to communicate very well with him. I don't believe he has insurance. Can you please talk to him? So we brought him in, and it turns out it was very difficult for his teacher to understand him because he had multiple deformities of the tongue and teeth. And they were unsure whether there was an intellectual disability as well or what. But anyway, so we finally gathered his story, and were put into touch with his sponsor family, who had just met him as well. And so we started trying to help him as best we could. And so luckily, through our UI Charities program, we were able to refer Junior to several specialty clinics, one of them being the ear, nose, and throat, genetics. We did some testing, and then to the Center of Disabilities and Development. And so all of those specialties have helped out enormously. We also have him referred now to ChildServe for therapy. Susie also mentioned our partnership with ChildServe. And all of these resources, bringing them together, Healthy Kids has been bringing these resources together to help someone, but we couldn't do it without the community and without generous gifts and funding. The funding for our coordinators to be able to piece all this together and get the care for the kids who need it, for the equipment that we use in the clinics. Anyway, he has gone on to start, he has I would say a beginner's level of English now, which is great. He's made a few friends in school. Obviously the barriers in front of him are multiple, but we are slowly breaking them down, and we are really happy to help him. And his family is his, I guess we could say foster family or sponsor family. They are working to help him get a legal status here and get him on their insurance from their employer. Another example, patient number 2, I'm going to call Paul. This is an example of an uninsured patient who is eligible for insurance. So usually what we do when we receive these calls for referrals, we try to sort out, because we have limited resources. So we can't just see kids because it's convenient, because we're in the school, and just, quickly see them because it'll take less time than their parents making an appointment and getting them a sports physical, let's say, somewhere else. And a lot of people forget about when those sports physicals come up, and then they come up and then they want to practice today. So we have to, because we have limited resources, unfortunately, we have to weed out, those that actually have insurance and should go see their provider, or those who truly don't have insurance, and we can help them with those sports physicals. We do many, many sports physicals. So we got this request, and I asked our usual questions and figured out that Paul is eligible. And so I start saying, okay, well, we'll contact the parents. The referral came in from a community member. I said, well, we'll contact the parents, and then we'll get them an appointment down at Johnson County to sign up to apply for Medicaid. However, then this person told me Paul's story. So Paul came to this area with his mother. His mother is homeless and quite unstable, and has had a history with drug addiction. And so he was living in the streets with her for a while, and then eventually left and was staying with friends, distant family members, just wherever he could stay, a teenager. And so still attending school, which is good, but it was actually through his basketball team that he made a friend, and this friend found out about his situation, and this friend's mother took him in, and this mother is the one that referred him. And so she was concerned about his living environment. She was concerned about maybe availability or access, exposure to drugs and alcohol, and no parental or adult supervision. And so she took him in. And so now she was just simply trying to get him a sports physical so he could continue participating in sports. Well, unfortunately, I mean, fortunately as well, but we have to have parental authorization to be able to see children, of course. And so I talked to her about that, and she said, you know, it's going to be really hard. It is extremely hard to reach his mother. And so, which was why obviously he doesn't have the Medicaid application and the coverage that he's eligible for. So I tried her again, and finally one day I was able to get her on the phone, and I said, can you please come in and sign Paul's consent so we can see him? This is not insurance. This isn't anything. This is so we can see him in our clinic. We see children who do not have insurance. He will be able to participate in basketball. And she came in. And I was really happy. It was beautiful because he was also there, and he probably hadn't seen her in months, but it was a sign that she loved him. And she signed his consent so that he could participate in basketball and be seen by us, and she disappeared again. But we are happy that we were able to connect with her that day, because it has helped us help Paul participate in basketball, which is something that makes him happy.
Hey, Salome.
Yeah.
We have just a few minutes.
Okay, sorry.
Let's do it. Actually, we have 1 minute left.
Okay, 1 minute. So anyway, what is great about his story is that we've been able to get him care, sports physicals, STD testing, some education, and have been able to link with the other community resources to help this kid out. So this is just another example. Thank you. Sorry I took up so much time.
No, thank you.
Wonderful.
And he is playing basketball.
Yay.
So, okay, so that's the end. Thank you. I really, again, thanks to all you Rotarians who have been very supportive, as well as other community members. And do we have time for questions, Devin?
We reached the 1 o'clock point, so not today, but we would encourage anyone with a question to reach out to you. Do you have an email address that you'd prefer to have questions emailed to?
Sure. Would you like, can I just say it?
Yes, go ahead.
It's POULTONSUSIE@gmail.com.
Great.
You could also
Thank
talk
you.
to Dr. Wallace. He knows what's going on.
Very good. Barb, you got it in the comments section. There it is. Well, thanks, Susie and Salome and then Dr. Wallace and everyone that works with the Healthy Kids program. Great presentation today. We sure appreciate it.
No problem.
We will wrap with our the four-way test. If everyone is able to stand with me and to recite it with me, of the things we think, say, or do. Is it the truth? Is it fair to all? Will it build goodwill and better friendships? Will it be beneficial
to all concerned.
Thanks everyone for attending, and we are adjourned.
Good to see you all. Bye.
Thanks.
Bye-bye.
Do you have any idea how long we're going to be?